Everyone, a very good morning to all of you. I welcome you all for today's session. Am I clearly visible and audible to you people? Let me confirm. Let me confirm in few seconds if I'm clearly visible and audible. I will start the session ahead. Okay. Just give me few seconds to confirm if I'm clearly visible, audible to you people. If you can see me clearly and am I audible, please give me a thumbs up in the chat box so I can start the lecture ahead. Okay, so I hope it's working. Thank you very much. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here and I welcome all of you for Unacademy Future Doctors. I hope you all are MBBS second prof students and you are preparing for your university exams. So Unacademy has taken this big initiative, a new initiative to help MBBS students to excel in their university exams. So this YouTube channel is dedicated for the students who are preparing for their university exams of MBBS. So I am Dr. Priyanka Sachdev here. I am your pathology educator and I will teach you pathology per se for the university exam preparation. So I will teach you the entire syllabus in a fast forward manner. So starting from the first chapter till last chapter. So I will cover entire pathology like general pathology, hematology, systemic pathology, everything I will cover. And not only this, I will cover theory also, practicals also. I will cover all 5 exercises of the practicals, potters, instruments, cards, everything from the practical viva voce point of view also. So I will help you with the short answers, long answers, 1 mark question, 2 mark question, 5 mark question, everything. And I will help you how to write answers in your university exam. Now, you may have seen that just suppose you are getting less marks in your university exams in the first prof, although you are studying more than your friends, but your friends are getting more marks in the university exam. Why so? Knowledge wise, you think you have more knowledge, but the problem is that many students don't know how to express that knowledge in the copy of the university exam. So you don't have to write the paragraph. Whatever question is asked in your university exam, you have to write your answer in points. So I will help you with that. That if this question is coming for 1 mark, you have to write this. If the same question coming for 2 marks, you have to write this portion. If the same question is coming for 5 marks, you have to write this portion. So I will help you, I will guide you for your university exam. And if you follow my instructions, from the first day, from first chapter till last chapter, if you follow me, I guarantee you, you will get distinction in pathology in your university exam of second prof. Take my words, mark my words, and revert me back after finishing the syllabus with your results. Okay, so without wasting time, I'm just starting it. Okay, before starting it, I would like to inform you that on Unacademy, we have 2 types of paid subscription. One is plus subscription, here you can see, and the other is iconic subscription. What's the difference between the 2 types of subscription? If you take plus subscription, you will get access to live and recorded lectures of Unacademy only from India's top educators. Not only this, you can compete with other learners with live tests and quizzes. You can access to exceptional question bank curated by us, by the India's top educators for you people, which contain more than 25,000 questions for you. And if you practice all these questions along with listening, watching live and recorded lectures, your selection in your competitive exam is also guaranteed along with the university exams. Not only this, you can download your notes, you can get the printed notes also. In iconic subscription, along with Unacademy, you will get recorded lectures of Prep Ladder. So that is the benefit. We all know that Unacademy has acquired Prep Ladder recently. So here in iconic, you will get the benefit of the both. So it is an advantage. On Unacademy, we focus on live classes, but here in iconic, along with the live classes of Unacademy, you can get quick revision from the recorded lectures of the Prep Ladder before your exam. So that is an advantage, you can say, right? So what you can do, you can go to Unacademy Learners app and check for various plans available. You can select your plan, whether you want plus plan or whether you want iconic plan, and you can select the duration of your plan. You want 18 months, 24 months, 36 months, various plans are available. Check the price for each plan. Check the price for each plan, and there is an exciting news for you. On whatever plan you are selecting, if you apply my code, that is Sachdev10, SACHDEV, Sachdev 10. If you apply this code just before payment, you will get straightforward 10% discount on the existing price. So please don't miss out this opportunity and learn this code. Okay. So in pathology, we already know we have three things: general pathology, hematology, systemic pathology. Today I will start with general pathology. General pathology. So in general pathology, we have 10 chapters in Robbins. Now, the book to be referred for my lectures is Robbins only. So you have to follow Robbins. All my notes are from Robbins only. So first watch my videos, whatever I am teaching you, just listen, see the video, watch the video. After that, make your notes from this video. Then open Robbins. Now read Robbins. Robbins will be cakewalk for you. Please take my words and it will be very easy to understand now. Because you have already watched the videos, you have understand the concept, you have a bird's eye view that what all is given in this chapter, you have make your notes. Now whatever additional information you get from Robbins, you can add in your notes. Done. So that is the thing. Anyways, so general pathology, I will start. In general pathology, these are the 5 chapters that you must read from Robbins. There is no escape. You have to cover these 5 first chapters from Robbins out of the 10. So cell adaptation injury, today I am going to start this chapter. Inflammation, then healing, then neoplasia, then hemodynamics. I will go in this sequence only. So I will teach you these 5 chapters in this sequence. In the subsequent day, in the next week, I guess I will cover all this, right? So from Robbins, you have to read these 5 chapters after watching my videos. So first watch my videos, make your notes. Make your notes. After making notes, read the Robbins. It will be very easy for you. Please, please believe me, trust me, and do it for once. Try it for once. These are the 5 chapters. It's your wish. If you have time, you can read it for Robbins, from Robbins. There is no harm in reading, but if you don't have time, your exams are just about to come, then don't go with Robbins for these chapters. You can take any other review book, a small book. So there are many review books available in the market, you already know. So whatever your seniors are suggesting you, you can go with that review book. Hirschman is a good review book, I guess. So you can go with that, because immunity is mostly covered in microbiology. Infections are also covered in microbiology. Genetics, you can go with review book only. Environmental, nutritional diseases, diseases of infancy and childhood is mainly covered in pediatrics. So you can read these from review book instead of Robbins. It's your wish, but better to go with Robbins always, right? From systemic pathology, these are the 6 systems you have to cover from Robbins, and these are the 6 systems you can read from review books if you don't have time. So that is my suggestion or advice to you. And in theory and practicals, in theory you have general pathology, you have paper 1 and paper 2, you already know. Paper 1 includes general pathology and hematology. Paper 2 includes systemic pathology, right? In practicals, we have spotters, exercises, table viva, grand viva, specimens, instrument cards. I will take one lecture on all of these, don't worry. So if you follow my lectures, you will get good marks in your practicals also along with theory. And in theory, as I'm telling you, if you are getting a 5-mark question on any topic, you get 2 5-mark questions. Now in paper 1 also, paper 2 also in most of the university. These are known as long questions. Now you cannot take risk with long question. Long question to karna hi hai. If long question nahi aata university mein, then your passing marks is risky, you know. So long questions are most important. Short questions and very short questions are also important. 1 mark, 2 mark, 3 mark. But 5-mark questions are most important questions. So whatever question you are getting for 5 marks, try to write down in this headings. Never write in paragraphs in university exam. Write down in this headings. Write introduction about that disease. Write etiology, risk factors, pathogenesis, clinical features, radiology, gross, microscopy, prognosis and outcomes. So in this sequence only, I will give you the entire pathology, especially the systemic pathology. So please note down this headings. And whatever question coming in your university exam, try to frame answer under these headings. Give me a thumbs up if you are getting it. If you are listening it, give me a thumbs up. I can see your chat, I guess. Okay. And in my lectures, there is no paragraph. In my lectures, you will get only flowcharts, images, line diagrams, and mnemonics. So that is my unique way of teaching. So let me start with the first chapter of pathology. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up fast. So I can start ahead. Just a second. Let me see. Okay. Yeah. Give me a thumbs up. Okay, so let me start with general pathology today. The first chapter of general pathology is cell adaptations. The first chapter contains 3 things: cell adaptation, cell injury, and cell death. So out of the 3 portions, I am taking first portion today, that is cell adaptation. I will take small lectures. I will not take lecture more than 45 minutes because it is scientifically proven that after 45 minutes, human concentration is, diverse. So you cannot concentrate for more than 45 minutes. So most of the lectures of our educators on this new platform, that is for MBBS future doctors. Most of the lectures are 45 to 50 minutes only. So there I will take multiple lectures, but of small span, you know. So in the first chapter, today, 45 minutes, I'm going to cover the first topic, that is cell adaptation. That is very important for your university exams. Okay. So before starting adaptation, let me tell you, human body is made up of cells. From head to toe, we all are made up of cells, right? From head to toe, we all are made up of cells. All our organs are made up of cells. There are three types of cells in human body: labile cells, stable cells, and permanent cells. These are the three types of cells present in human body. Let me tell you the difference between them. Labile cells are those cells which continuously divide. The cell of our mucosa, the cell of the bone marrow, hematopoietic stem cells of the bone marrow, which continuously form RBC, WBC, platelet, the cells of the intestinal lining, which the cells of the skin. So they continuously divide, and divide. They do mitosis, they do cell division. That is labile cells. Stable cells are those cells which after reaching in adult life, once they reach in adult life, post neonatal life, they do not divide. Before that, they divide. They do not divide. Like the cells of our liver, the cells of our kidney, once the adult size is reached, they do not divide further. But if any injury is taking place inside them, if any injury occurs to the liver, to the kidney, then they have capability to division, to do the cell division. So usually they do not divide, but they have capability of cell division if the organ is injured, if there is any injury. So injury is the stimulus for them. Have you got it? And the third type of cells, that is permanent cells, are the cells of the heart, that is cardiocytes, and the cells of the brain, that is neurons. So these two organs have permanent cells or terminal cells. They do not divide at all, neither normally nor after injury. So once the person is having MI, myocardial infarction, or once the person having stroke, so any injury is happening. Here injury is happening. Even after injury, the damage is permanent and healing do not take place. It is irreversible. So they do not divide even after injury. Have you got it? So labile cells are the cells which continuously divide. Stable normally do not divide, but have capability to do the cell division after injury. And permanent cells or terminal cells are those which do not divide even after injury. So see, because you should have these basic knowledge. So labile cells are the cells which continuously divide. So examples: hematopoietic stem cells in the bone marrow, cells of skin, oral cavity, vagina, cervix, salivary duct. So they continuously divide. Stable cells, they do cell division in response to injury. Normally they do not divide. So like liver, renal cells, pancreas cells, right? And permanent cells are those cells which are terminal. They are non-proliferative. They do not divide at all, even after injury. So cells of the neurons in the brain, that is neurons, and cardiomyocytes in the heart. So heart and brain, these are the two organs which have non-proliferative cell. Now in the cell cycle, we know there are four phases: G1, S, G2 and M. G1, S, G2, M. We know it, right? So and M also have various type of subphases. We know it. Okay. So so tell me the three type of the cells. So labile cells are those cells which are continuously in some of the phase of the cell cycle. Either they are in G1 or S or G2 or M, because they are continuously dividing, right? Stable cells, also known as quiescent cells, they are in G0. That is, they do not divide, but they can enter into G1 once injury take place. So they always remain in G0. Once injury take place, they will enter in G1. So they are in G0. And permanent cells or terminal cells, they are out of cell cycle. They are out of cell cycle. They cannot enter in less cell cycle. Give me a thumbs up if you got it. Give me a thumbs up. Okay. So let me start my chapter today. So as we know, human body from head to toe, it is made up of cells. So the complete human body, all our organs is made up of cells. Cells is the structural and functional unit. So all the organs are made up of cell, right? Okay. So all the cells are in homeostasis. What do you mean by homeostasis? This is a cell. All the cells in the body are in homeostasis. That is, the cells have somewhat different structure for performing different function. Just for example, the cells of the brain are specialized for memory, for concentration, right? So they have somewhat different structure for performing their special function. The cells of the salivary gland, they do secretion. So they are special in doing secretion. The cells of the bone marrow, they are dividing for forming the RBC, WBC, platelet. So all the cells have somewhat different structure for performing their specific function. That is known as homeostasis, right? So whenever this is a cell, whenever any stress is acting on the cell, whether it is physiological or pathological. What is the difference between physiological and pathological? Basics. What is the difference between physiological and pathological? Physio and patho. So physiological means that is normal. That is considered as normal. Just suppose menstruation in females, pregnancy in females, aging. So these all conditions which are in which cell has to have some changes inside it. But these are considered as normal. These are not, menstruation is not a disease. Pregnancy is not a disease. Aging is not a disease, right? So these are considered as normal. And pathological means some disease. So any stress on the cell is having, then three things will happen. The first thing, to overcome that stress, cell will do some changes in the structure. Changes in the structure, inside which the structure of the cell will be changed to overcome that stress. This is known as adaptation. This is known as adaptation. In order to survive, cell is doing that. So if the stress is continued, the second thing cell will do is injury, cell injury. Cell injury will take place. So first cell adaptation take place, second cell injury take place. Cell injury is of two types. First, reversible cell injury take place. If stress is still continued, it is not removed, still it is continued. Then the third and last thing which take place is irreversible cell injury. Irreversible cell injury is also known as cell death. So irreversible cell injury का मतलब है cell death हो गया है. Cell death is of two types, apoptosis and necrosis. These are the two types of cell death. Whenever I will teach you cell death, I will tell you the differences between them. Now, some cells die by apoptosis. Some cells die by necrosis. What is the difference between them? Why any cell is dying? And if it is dying, there are two options. So which option has to be selected? So there are two types of cell death, apoptosis, necrosis. Both are highly important topics for your university exam. So every year, some question comes on apoptosis or necrosis. So either it is a 2-mark question or mainly it is 5-mark question. You have to understand it. So three things. First, adaptation, then cell injury, reversible cell injury, and then cell death. So these are the three topics which I have to cover in the first chapter. So cell adaptation today I will teach you. Then cell injury tomorrow I will teach you. And cell death a day after tomorrow I will teach you. So I will take the first chapter in 3 portions, 40, 40, 40 minutes, right? So that is the thing. And I will give you important questions on that also, right? So that is the thing. So you can see, okay. So till now, cell injury first is reversible, then there is irreversible, as I have told you. So this is known as point of no return. इससे पहले, from this point, before this point, if you remove the stress, everything will reverse. But after this point, nothing will reverse. That is point of no return. So this is known as point of no return. Point of no return between reversible and irreversible cell injury. Have you got it? Have you got it? That is known as point of no return. Point of. So can I say first thing which takes place is adaptation. Second thing which takes place is reversible injury. The third and the last thing which takes place is irreversible cell injury. That is also known as cell death. So these are the stages of progressive impairment of cell's normal structure and function. So cell का normal structure और function progressively change होता जा रहा है. थोड़ा सा change हो रहा है, it is known as adaptation. और ज्यादा change हो रहा है, it is known as reversible injury. Cell मर ही गया, cell death हो गया, तो it is irreversible cell injury. So these are progressive impairment of the same series. Have you got it? So 3 chapters we have to study. Today in this lecture I will teach you only adaptation. After that, cell injury, reversible cell injury, then irreversible cell injury, that is cell death. Give me a thumbs up, everyone. Everyone, give me a thumbs up. Yes. Okay. So, let me start. Okay. So, students are asking, please take a crash course on pharma and micro also for university exam. Okay, I will consider your request and I will try to do that. First, let me start with pathology and let me see how it works. Okay, so cell adaptation. If you have any doubt, please write in the chat box. I will definitely address it. So cell adaptation. So what is the definition? So this is the definition given in Robbins for cell adaptation. You have to learn all definition from Robbins only, right? All diagrams, all definitions from Robbins. From Robbins, right? Now it is a big definition. So let me split it into 4 parts. So this is the same definition. I have splitted it in this 4 parts. Have you got it? You have to split the definition into 4 parts. Listen. Cell adaptations. What are cell adaptations? These are the structural changes of a cell due to physiological or pathological stress. So whenever on any cell, if you are providing either physiological stress or pathological stress, the cell will change its structure. So that is structural changes in order to achieve a new steady state. पहले वो steady state में था. The cell was in homeostasis, but you have disturbed the homeostasis by causing stress. So to achieve new steady state, cell is doing this in order to survive and to continue to function. Otherwise, cell will be dead now. Just suppose tomorrow is my exam. Tomorrow is my university exam. So daily I study for 8 hours. Daily I study for 8 hours. My body is maintained for that. But tomorrow is my exam. So exam is a stress for me. It is a physiological stress. It is a stress. So my body got stressed. So today I will study for 18 hours. So I will do some structural functional changes inside my body to overcome this stress, to do to achieve a new steady state. My steady state is 8 hours. Daily I study for 8 hours very comfortably. But 18 to study instead of 8 hours, now I have to study for 18 hours. So I have to do some structural and functional changes inside my body. So that is adaptation. I'm adopting for my exams. So that is the thing. In order to survive, to continue to function. And these are reversible. What do you mean by reversible? Once you remove the stress, it will be, once the exam is over, you cannot continue studying 18 hours for always. No, again you will study only for 8 hours. So that is reversible. That is how you have to learn. Give me a thumbs up if you got it. Give me a thumbs up. That is the definition. Now read the definition from Robbins. So adaptations are reversible functional and structural changes in order to physiological stress or pathological stress during which a new but altered steady state is achieved. That is homeostasis is achieved in order to survive and continue to function. So it is a difficult definition, but you can split it into 4 parts to understand it. So the same cell, so any stress, physiological or pathological, the first thing, in order to survive and continue to function, cell will do some changes in the structure and function, and those changes are known as cell adaptation, and these are always reversible. On withdrawal of the stress, the cell will again come to its normal structure which was previously. Now there are 5 types of adaptations, as we all know: hypertrophy, hyperplasia, atrophy, metaplasia and dysplasia. Okay, so see here, this is a cell. You can see if this cell increase in size, see size is increased here, size is increased, it is known as trophy. Trophy का मतलब होता है size, trophy का मतलब होता है size, you know. And if the cell is increased in number, size is same, but you can see instead of 1 it is 3. So here number is increased, so it is known as plasia. Both are hyper. Trophy का मतलब होता है size, plasia का मतलब होता है number. So size बढ़ रहा है कि number बढ़ रहा है? स्ट्रेस की वजह से उसमें स्ट्रक्चरल चेंज हो रहा है, तो स्ट्रक्चरल चेंज में वो अपना साइज बढ़ा रहा है कि अपना नंबर बढ़ा रहा है? So that is the thing. If exam is coming, I have to study for 18 hours. So whether I am increasing my size or I am increasing my number? No, increasing the number is not possible. I am not cloning myself, but just for example. So there are 2 options to the cell. Cell can increase to the size because of stress or increase in number because of the stress. So hypertrophy and hyperplasia. These are the 2 types of cell adaptation. The third is atrophy. See, size and number both is decreased. Now listen, very few students know this. Size and number both is decreased. So size बढ़ रहा है. If size is increasing, the term is known as hypertrophy. If number is increasing, the term is known as hyperplasia. तो size and number के बढ़ने का अलग-अलग term है. लेकिन if both of them, any one of them is decreasing, the term is atrophy. Atrophy is for both. Size decreasing, term is atrophy. Number decreasing, the term is atrophy. So atrophy includes both, not only size. Most of the students think that atrophy means decrease in size. No. Along with decrease in size, atrophy means decrease in number also. Please mark this point. Have you got it? The fourth is metaplasia. If you convert from one type of cell to another type of cell, just suppose it was a squamous cell, it got converted to columnar, or it was columnar cell, vice versa, and it got converted to squamous. So this is known as metaplasia, conversion of one type of cell into another type of cells. Have you got it? And last is dysplasia. Dysplasia is altered cellular development. I will tell you the definition of dysplasia. So these are the 5 type of adaptations. You can see this one is atrophy, decrease in size and number. The first one, you can see this is hypertrophy, increase in size. These are 4. These are also 4, but size is more. Increase in number, instead of 4, they become 8, but the size is same. That is hyperplasia. Metaplasia, these are squamous and they got converted into columnar, or these are columnar, got converted into squamous. And the last is dysplasia. Dysplasia is pre-malignant. It is a pre-malignant lesion. I will teach you all 5 in details. So I ask you to make this table with me. Please make this table with me. So first I will teach you hyperplasia, then hypertrophy, then atrophy, then metaplasia, then dysplasia, in this sequence only. And I will teach you the definition of each of them. We have already discussed the definition. The diagram for each of them. You know the diagram already I have discussed. The mechanism for each of them, the examples of each of them, and morphological changes in each of them. If any one of them is coming in your exam, it will be a 2-mark or 3-mark question. Write a short note on hyperplasia, hypertrophy, atrophy, metaplasia or dysplasia. Anything can come in your exam either for 2 marks or 3 marks. You have to write in these headings. Don't write paragraphs, write in these 5 headings. If it is a 5-mark question, it will come, write a short note on cell adaptations. Then you have to write all 5. You have to write all 5 under this headings only. Give me a thumbs up if you got my point. Everyone give me a thumbs up. If you got my point, please give me a thumbs up. Okay. Okay. So let me start. So I'm starting with hyperplasia. So as I have told you, plasia means number. So the definition is increase in number of the cell, not the size of the cell. It is increase in number of the cell, but not the size of the cell. So I have told you there are 3 type of cells, na? Labile cells, stable cells and permanent cells. Out of which this hyperplasia is shown by which type of cells? Increase in number. So the cell which can divide, that can show hyperplasia. So labile cells continuously divide, they can show hyperplasia. Stable cells normally do not divide, but as a part of injury they can divide. So they can also show hyperplasia, but permanent cells cannot show hyperplasia. The cells of the heart and brain cannot show hyperplasia. Have you got it? That is the definition. So this is the diagram. See, this is the cell. This is a normal cell. And whenever any stress is coming, that is physiological or pathological, the cell is adopting by increase in number. See, the size is same. Number is increasing. That is known as hyperplasia. So this is the diagram. Mechanism. How number is increased? Number kaise badha? How number is increased? Okay, let me tell you. So this is the cell. This one is the cell. This one cell want to increase the number because of the stress. So what the cell will do, cell will increase the number of growth receptors on its surface. Normally 2 growth receptors are present, so instead of 2 it will do 20 growth receptors. So growth receptors will increase. So when growth factor will come and bind with the growth receptor, then cell undergo mitosis. Initially only 1 or 2 growth receptor was present, but now multiple growth receptors are present. So cell mitosis will increase. So that is how it is increasing in number. It is increased production of growth factor and growth factor receptors. Have you got it? That is the mechanism. In one line you have to say. Have you got it? So this is the cell. On the surface of the cell we have growth receptor. With this growth receptor, growth factor come and bind. This is growth factor. Growth factor come, bind with this growth receptor. Then only this cell undergo mitosis. So when one growth factor is coming, binding with one growth receptor, out of the one, 2 cells are formed. So instead of 1, the growth receptor will increase to multiple because the cell want to do the hyperplasia. So multiple growth receptors and multiple growth factors. So multiple cell division. So it will increase in number. That is the mechanism. Have you got it? Mechanism. Coming on types, examples. So there are 2 types, physiological and pathological. Tell me 3 examples of physiological and 3 examples of pathological hyperplasia. Examples are more important. They are asked in Viva also. This topic is important for Viva also. So examples are important. So physiological. Okay, these are the 3 examples of physiological hyperplasia. So female breast, during puberty, pregnancy and lactation. Okay, let me draw. This is a female breast. This is the nipple. This is a female breast. So female breast is made up of cells. Okay, so this is the cells of the female breast, right? These are the cells. So female breast have a normal size because of normal number of the cells, right? Now what is happening if this female is pregnant? Either she is pregnant or after pregnancy she is breastfeeding the child, that is lactating. The female is lactating after the birth of the child, or the female is entered the puberty, just at 14 or 15 years of age, sudden increase in breast size of the female. So that is puberty. So in either of the 3 conditions, the size of the female breast increases abruptly. The size of the female breast increases abruptly in pregnancy also, in lactation also, and in puberty also. How? Size kaise bada? Because the cells inside it, they are doing hyperplasia. So initially, just suppose 100 cells were there, instead of 100 they got 1000. So that is due to hyperplasia. So more cells. So more cells ki wajah se the organ size is increased. So that is the first example. Give me a thumbs up, everyone. Have you got it? Give me a thumbs up. So hyperplasia of the female breast at puberty, pregnancy and lactation. That is the first example. Have you got it? Second example is uterus during pregnancy. So see, this is a normal uterus. This is the size of a normal non-pregnant uterus. When the female got pregnant, this is the size of the uterus. This is because this uterus have to accommodate fetus now. So it has to increase in size. So how size is increased? How the size of the uterus is increased? Have you thought? So these are the cells present in the myometrium of the uterus. They will undergo hypertrophy also, and they will undergo hyperplasia also. So all the cells will increase in size also, they will increase in number also. So it is an example of both. Pregnant uterus is an example of both hypertrophy and hyperplasia. So overall size will increase. Breast is an example of only hyperplasia. But pregnant uterus is an example of hyperplasia also, hypertrophy also. Learn it. Please learn it. And the third example is endometrium during menstruation. Okay. So can you see? This is the uterus. Uterus have three linings. Three linings. The innermost lining is endometrium. This is endometrial lining. This is myometrium. The middle one is the myometrium and outermost is the serosa. There are three layers in the uterus, right? So during menstruation, what happens? The endometrium sheds off during bleeding. So this is endometrium. It sheds off in the bleeding, in menstrual bleeding. It sheds off. So that is normal physiologically. Menstruation occurs every 28 days in females. Menstruation, right? Menstruation. So after menstruation, what will happen? Most of these cells are shed off. इक्का दुक्का बच जाएंगे. So few of them are remaining. Almost all of them are shed off. The one which are remaining, they will again do the hyperplasia. They will do the hyperplasia again, the one which are remaining, and again they will regenerate the endometrial lining for the next menstrual cycle. So within 28 days, it is regenerated. So it is doing an hyperplasia every month after menstruation. So the third example is endometrium. After a normal menstrual cycle, it proliferates and again regenerate to get shed off in the next month. That is the thing. Give me three examples. Everyone give me a thumbs up and learn the three examples. Everyone. If you have any doubt in this, please ask it. Please ask it. If you have any doubt, please ask it. So what are the three examples? Female breast, uterus in pregnancy, and endometrium. These are the three examples of. So here you can see this is a diagram from Robbins. A beautiful diagram. Let me show you what information. So this is a normal uterus. This is a normal non-pregnant uterus. And during pregnancy, please compare the size. It got converted to this much size. So it increases. This is a gross diagram. Grossly you can see. So if I cut this uterus and make a slide, and if I cut this uterus also, make a slide. So see, this slide is of non-pregnant uterus, and this slide of pregnant uterus. See, now see the microscopy, compare. You can see the size of the cell here. All the cells are small size. See here the size of the cell. See here the size of the cell. Can you see the size of the cell here? Here, if you count the total number is less here, and if you count the total number, the number is more here. So it is an example of pregnant uterus is an example of both hypertrophy also and hyperplasia also. So can you understand this diagram? Can you make this diagram in your university exam? So gross comparison also यहाँ पे shown and microscopic comparison also it is shown between the pregnant and non-pregnant uterus. Grossly they are also compared and microscopically also they are compared. Give me a thumbs up everyone. So this is the example of female breast. I have already drawn this diagram for you. This is the nipple. You can see the female breast, and during pregnancy, lactation, puberty, see the size. So compare it. So the size is increasing. So it is by hypertrophy and it is by hyperplasia. These are the three examples of physiological hyperplasia. Let me come on pathological hyperplasia now. Pathological hyperplasia. So in pathological hyperplasia, again we have three examples. The first one is endometrial hyperplasia due to estrogen axis. Now here the stress is estrogen axis. Now if any lady, this is the uterus. The innermost lining of the uterus is endometrium. So endometrium is a single layered lining, right? If any female is given excessive estrogen in the form of the tablets, in the form of the OCPs, in the form of some other disease, she has to take excessive estrogen from the body, from outside in the form of the tablets or some food material. So that is a stress for this endometrium, and it will undergo increased cell division, and it will proliferate, and it will form multi-layered endometrial lining. Now such female will present with a disease. The disease is known as endometrial hyperplasia. So she will come to the gynecologist with a complaint of excessive bleeding. So she will present with excessive bleeding, and if you do the sonography, you will find the endometrium is thickened. The endometrium is thickened because of excessive proliferation. So she is having a disease. The name of the disease is endometrial hyperplasia, and the stress for the disease is estrogen axis. So that is the thing. The second is skin warts. Here the stress is HPV virus. So this is skin. This is endometrium. Can you see? This is normal single layered, and this is multi-layered. It becomes multi-layered, and it will result in excessive bleeding because of estrogen axis. The disease is known as endometrial hyperplasia. Okay, so these are the skin warts. There is a virus known as HPV. That is human papilloma virus. If that virus is entering in the skin, just suppose here it is entering in any skin, any person's skin. So it is a stress. It is a stress, and the cells of the skin here, they will undergo hyperplasia. They will divide and they will form small nodules due to hyperplasia. These are known as warts. Warts. So the disease is known as warts. So the warts due to HPV. That is the thing. Have you got it? So these are the two examples you can learn for pathological. So three examples of physiological and two for pathological. I have told you. Last thing is morphology. Morphology. So cell here, morphology. The cells are increasing in number. So because of increase in number, overall organ is enlarged and increased mitosis is there. So I am done with hyperplasia. You know the definition? Yes. It is increase in number, not size. Negative finding भी लिखनी है आपको एग्जाम में. It is increase in number of the cell, not the size of the cell. Write both. Diagram, you can make the diagram. Mechanism, it is due to increase in growth factor and growth factor receptor. That is the mechanism. Examples, there are two types. Physiological, I have taught you three examples. And pathological, I have taught you two examples. So write three examples here and two examples here. Morphology, increase number, increase size, increase organ size due to increase in number, and increase mitosis. These are the three things morphologically you can see. Give me a thumbs up. So let me start the second adaptation, hypertrophy. Hypertrophy. Trophy का मतलब होता है size. Size. यहाँ पे number बढ़ रहा था, size नहीं. यहाँ पे size बढ़ेगा, number नहीं. So increase in size, not number. Let me start the second, hypertrophy. Trophy का मतलब होता है size. Can you see? Size. So increase in size, not the number. Right? Negative finding also. Again I am saying. So there are three types of cells, na? Labile cell, stable cell, and permanent cell. So it is increase in size, not the number. So which cell can show this type of adaptation? This hypertrophy is shown by all three cells. All three cells can show hypertrophy because size to sab बढ़ा सकते हैं ना. So what I mean to say, labile cell, stable cell, and permanent cell. Okay, hyperplasia and hypertrophy. Hyperplasia is increase in number, and hypertrophy is increase in size. We know. So which type of cell show which type of adaptation? So hyperplasia can be shown by, it is shown by labile, stable, but not permanent, because permanent cannot divide. So they cannot increase in number. They cannot do mitosis. They cannot do. But hypertrophy is shown by all. That is the difference. That is. So what I mean to say here, one line which is given in Robbins is that hypertrophy is the only adaptation which can be done by permanent cells. Permanent cell cannot do hyperplasia. They can do only hypertrophy. Which are permanent cells? The heart cells, cardiac cells, and the brain, that is neurons. So have you heard the term left ventricular hypertrophy? Left ventricular hypertrophy, you have heard this term. Have you ever heard the term left ventricular hyperplasia? No, you have not heard, क्योंकि ऐसा होता ही नहीं है. There is no thing like this. So we have heard the thing left ventricular hypertrophy of the heart, but we have not heard the left ventricular hyperplasia. That is the reason. Again a very important viva question कि left ventricular सिर्फ hypertrophy क्यों होती है, hyperplasia क्यों नहीं होता है? Why it is LVH? What is the full form of LVH? LVH is left ventricular hypertrophy. Why it is not left ventricular hyperplasia? It is most commonly asked in the vivas. Give me a thumbs up if you got it. Give me a thumbs up in the chat box. So this is the diagram. Can you see? This is a normal cell. This is the stress acting on it, and the cell is increasing in size. यहाँ पे भी only one cell, यहाँ पे भी only one cell. So number is same, but the size is increasing. That is the diagram. Mechanism. Why the cell is increased in number? Listen, the cell is increased in number. Here the cell contains nucleus. Here also one nucleus. But here the cell contains endoplasmic reticulum. The cell contains ribosomes. The cell contains mitochondria. These are known as cell organelles. Cell organelles. Cell organelles. So here the cell organelles are increasing. That's why the size is increased. No, it is not due to swelling. Swelling. It is not swelling of the cell. Nahi, swelling nahi hai. This option rule out. It is not the swelling. It is due to more structural component, more cell organelles. It is not due to cell swelling. Not due to. More cell proteins are there. So that is the mechanism. That is the mechanism. Types, again two types. Physiological, pathological. Tell me examples of each of them. One example of physiological and one example of pathological. The one example of physiological, I have already told you, pregnant uterus. Pregnant uterus. Pregnant uterus is an example of both physiological hypertrophy as well as hyperplasia. So this is non-pregnant uterus, you can see here, and this is pregnant. Compare the gross. Compare the gross. And this is non-pregnant, this is pregnant. Compare the microscopy. See the cell size here. They are small, 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 small. And see the cell size here. They are large, 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 large. So cell size is increased during pregnancy. So that is the example of hypertrophy. So same diagram, same example. Pathological, there are three examples. Pathological. Okay, we have three type of muscles. Now, what are the three type of muscles in human body? What are the three type of muscles in human body? Cardiac muscles, smooth muscles, and skeletal muscles. These are the three type of muscles in human body. Cardiac, smooth, and skeletal. These are, okay, let me tell you. Okay, let me see. This is a heart. You can see this is the complete cycle. You can see this is left ventricle, left auricle, left ventricle. This is right auricle and right ventricle. If there is a aortic stenosis, aortic wall stenosis, or aortic valvular disease is there, or hypertension in the aorta, systemic hypertension in the aorta is there. So what will happen? You can see this is the left ventricle. During systole, the left ventricle contracts, so all the blood moves in the aorta. But here there is a problem with the aortic valve. So blood during systole, it is not going to the aorta. It is unable to go to the aorta. So this is a stress. This is a stress for the left ventricle. So what left ventricle will do? The left ventricle wall, this is the wall of the left ventricle. You can see the wall. So left ventricle will increase the thickness of the wall by increasing the size of the cells inside it. So size of the cell inside it will be more. So left ventricular wall will become thickened. So now when it will do systole, it will be with more pressure, more vigorous contraction. So more blood will go. So that is the structural adaptation the left ventricle is doing. This is known as left ventricular hypertrophy, which is seen in aortic wall disease, aortic stenosis, and in hypertension. Now coming on smooth muscle. Smooth muscle, I will give you an example of cardiac achalasia. What is cardiac achalasia? You know what is cardiac achalasia? See, this is esophagus. Everyone see. Normally this is esophagus and this is stomach. This is stomach. Can you see? And there is a sphincter. This is known as lower esophagus sphincter. Normally this sphincter is closed, but whenever I eat anything, I swallow anything, so whenever food is coming in the esophagus, it open and transit the food from the esophagus to the stomach. So food got transit from the esophagus to stomach when it is opening. Now there is a disease known as achalasia, in which this LES is closed permanently. It doesn't relax. It doesn't open. This LES is closed. So whenever food is coming here, it cannot move to the stomach. Food cannot move in this disease. So esophagus, the wall of the esophagus will become thick, thick and thick to do the vigorous peristalsis, to push the food in here. So that is a stress, you know. So this is known as achalasia. So in achalasia, the esophagus is doing hypertrophy. In aortic wall disease, the left ventricle is doing hypertrophy. And skeletal muscles, you can say these are the, laborers, the person who is doing a gym. You all go to the gym. So you have good biceps and triceps. Can you see? These are the biceps, tricep muscles. So they are more large as compared to normal person now, who is not doing the gymming, not doing the laborious work. So why? Have you ever thought why the size of bicep and tricep muscle is increased in such person? Because of hypertrophy. Because of hypertrophy. Have you got it? So that is the three examples are there. Morphologically, the organ is enlarged. It is due to increased protein, increased cell organelles, increased mitochondria, increased endoplasmic reticulum, myofibrils, and ribosomes. So I am done with hyperplasia. I am done with hypertrophy. Give me a thumbs up. Any doubt? Please, if you have any doubt, don't hesitate to ask. Please ask in the chat box. I can see your chat. I can see your chat. Please, if you have any doubt, write it down specifically what is your doubt. So in your university exam, you have to write in this headings only. Write the definition. So here, definition may, it is increase in number, it is plasia, and increase in size, it is trophy. Never get confused. Diagram, you can draw it. तो यहाँ पे आपको number बढ़ाना है, number of the cell, यहाँ पे आपको size of the cell बढ़ाना है, number नहीं बढ़ाना है. Mechanism, here it is due to increased growth receptor and growth factor. Here it is due to increased cell organelles. Cell organelles बढ़ गए उसके अंदर के cell organelles, mitochondria, ribosomes, they increase. That's why the cell increase in size. Examples यहाँ पे भी दो हैं, physiological, pathological. यहाँ पे भी दो हैं, physiological, pathological. You should know the examples. So name 3 examples here, 3 here, 1 here, 2 here, whatever. You have to learn the examples. Examples are must to be known. And morphology I have already discussed. यहाँ पे भी organ का size बढ़ेगा, यहाँ पे भी बढ़ेगा. यहाँ पे cell number की वजह से organ का size बढ़ेगा. यहाँ पे size of the cell बढ़ने की वजह से organ का size बढ़ेगा. यहाँ mitosis बढ़ेगा, यहाँ mitosis नहीं बढ़ेगा, cell organelles बढ़ेंगे. So that is the morphology. Give me a thumbs up. So this is the most simplified way I can teach you. Everyone give me a thumbs up. If I'm asking for it, give me a thumbs up in the chat box. No? I should interact with you. You can see me, but I cannot see you here. No, I can see your chat only. I cannot see your faces, that whether you are listening, whether you got it or you do not got it. The only way to communicate is via chat, right? So give me a thumbs up in the chat box, or write you understood, so that I can move to the next topic. Give me a thumbs up, fatafat. So coming to the next type of adaptation is atrophy. The third type of adaptation is atrophy. Give me a thumbs up. Atrophy. Okay, good. So what is atrophy? What is atrophy? So here it will be decrease in number and decrease in size. Both, not only number, not only size, both are decreasing. It is known as atrophy. If number is decreasing, the term is atrophy. If size is decreasing, the term is atrophy. If both are decreasing, the term is atrophy. So atrophy सबके लिए है. So it is decrease in size as well as number. Decrease, that is the thing. लेकिन if the cell decrease in the size, it is not the thing the cell is dead. Till that point only the size will decrease, the cells still remain viable. उससे कम नहीं होगा, उससे कम नहीं होगा. Minimum there is a cutoff कि इससे छोटा cell will be dead. No, the cell is not dead. The cell is still viable. Cell decrease in size, but still viable. Till that point only it decrease in size. उससे कम नहीं होगा. So you see the size here and see the size here. So size is decreasing due to the stress. The size is decreasing. What is the mechanism? The mechanism is reduction in cell organelle. Reduction. Why? Here just suppose there are 5 mitochondria, so here is only 1 mitochondria. Here there are 5 ribosomes, here only, just for example, 1 ribosome. So all the cell organelles are reduced in number. That's why there is shrinkage. That's why. That is the reason for shrinkage. That is the reason for shrinkage of the cell. Is due to reduction in cell organelles, mitochondria, endoplasmic reticulum, myofibrils. So all these things are reducing. Again, types, there are 2 types as usual, physiological, pathological. Tell me 7 examples of physiological. 7 examples of physiological and few examples of pathological also. Who will tell me? Very important, very important. Okay, these are the 6, sorry not 7, 6 examples of physiological atrophy. Physiologically हमारी body में कहाँ कहाँ atrophy थी? Physiological, it is not disease. Atrophy, the organ reduce in size. You know, we have various lymph nodes, lymphoid tissue, which are more enlarged during childhood, but as the age increases, they decrease in size. We know we have thymus when we are embryo, when we are child, but in adult life, the thymus disappear. We all know, you have studied this in embryology, right? Gonads, I mean ovary after menopause, it shrink in size, right? The ovary in females shrink in size after menopause. Before menopause, it is enlarged in size, but after menopause, after 45 to 55 years in female, after menstrual cycle is stopped, menopause, the ovary shrink in size. So it is physiological. It is not a disease. It is normal. So it is physiological. So uterus after parturition. What do you mean by parturition? Parturition means delivery. So as I have told you, this is normal uterus. This is non-pregnant uterus. During pregnancy, it increases in size. This is pregnancy. The reason for increase is hypertrophy also, hyperplasia also. So the cells here increase in size also, increase in number also. So these cells are increasing in size and the same cells are increasing in number. That's why the organ is increased. Now after delivery what happens? After delivery, it again come to the यहाँ से यहाँ हुआ. Now it has to again shrink. तो shrink कैसे होता है? This is known as parturition. This is parturition. Parturition में वापस shrink कैसे होगा? It is due to atrophy. It is due to, so these cells, the cells present here, they will decrease in number and size. So they will do atrophy. So due to hypertrophy, it is increasing in number and size, and due to atrophy, it is again becoming to non-pregnant size. So this is an example of atrophy. Give me a thumbs up. So okay, have you got it? Have you got it? So normal non-pregnancy से pregnancy में जाने के लिए और pregnancy state से parturition में वापस आने के लिए. So my point is that this is an example of hypertrophy and hyperplasia both. And this is an example of atrophy. So uterus is an example of 3 adaptation. Have you got it? Give me a thumbs up. So that is the thing. That is the thing. You know, brain size. The size of the brain decreases with age. You know, so you can see this is a normal brain. You can see it is a diagram from Robbins. That's why I'm showing you. This is a normal brain. See the gyri and sulci. You know, gyri is the elevation, sulci is the depression. See gyri and sulci here. So gyri become more prominent, sulci become more deep because most of the substances disappearing. That is known as atrophy. I'm sorry. That is known as brain atrophy. Brain atrophy. So that is physiological. And bones trabeculae, they become thinned out with the age. That is known as osteoporosis. So these are the examples of 6 physiological atrophy. Now let me tell you the 6 examples of pathological. 6 यहाँ बताया तो 6 वहां भी बताओ. 6 examples of both. The first pathological atrophy is starvation. If the person is not eating anything, not eating, so all the organs will reduce in size. That is known as starvation atrophy. Due to starvation, it is known as cachexia. It is seen in cancer patient or severe ill patient. Patient is not eating anything. Starvation ki wajah se. Second is ischemia. You know, so this is aorta. This is the two renal arteries. Can you see this renal artery is stenosed. It is obstructed here. So blood is not going here. If blood is not going here, so compare the size of the kidney. This kidney is less in size. It is more in size. So it is due to less in size because of ischemia, because of less blood. So it is known as ischemic atrophy. The third is neuropathic atrophy. Neuropathic, you know, polio. In polio, what happens? The nerves are abnormal. There is a problem with the nerves. The virus is damaging. Polio virus is damaging the nerves. So these muscles got atrophied because not muscle में problem नहीं है, problem nerve में है. So neuropathic atrophy का example है polio. Polio is the example of neuropathic. And last is disuse atrophy. If you know, if person is having fracture, just suppose, okay, I'm having a fracture. I'm having a fracture here. Just suppose here or here, humerus, I'm having a fracture here. So I will have a cast here for the 1 month, 2 months. So I will not use this hand. After 2 months, when I will open it, but this hand, this arm will thinner as compared to this arm because the muscles here got atrophied because it is not in use. It is known as disuse atrophy. The fourth one is disuse. It is not used for a long time. So starvation, ischemic, neuropathic, disuse. Starvation में आ जाएगा cachexia. इस्चेमिक में आ जाएगा रीनल आर्टरी स्टेनोसिस. न्यूरोपैथिक में आ जाएगा पोलियो, राइट? इट इज पोलियो. एंड डिसयूज में आ जाएगा फ्रैक्चर, कास्ट. द फिफ्थ वन इज एंडोट्रोफिक, एंडोक्राइन एट्रोफी. यू नो व्हाट इज एंडोक्राइन? दिस इज हाइपोथैलेमस, दिस इज पिट्यूटरी एंड दीज आर द ऑर्गन्स. हाइपोथैलेमस से टीआरएच, सीआरएच और जीएनआरएच रिलीज होता है. पिट्यूटरी से एसीटीएच, टीएसएच, एफएसएच, एलएच रिलीज होता है. एसीटीएच गो टू एड्रिनल ग्लैंड, TSH go to the thyroid, and LHFSH go to the gonads, ovaries and testes, right? If the person is having hypopituitarism, pituitary damage ho gayi, so this will not release, this will not release, this will not release. So size of these organs is less. So they will have small adrenal, they will have small thyroid, they will have small gonads. The problem not with these organs, the problem with the pituitary. So the hypopituitarism leads to atrophy of 3 organs: thyroid, adrenal, and gonads, ovaries or testes. Because the problem is with the pituitary. That is known as endocrine atrophy. The next is pressure atrophy. Can you see there is a meningioma here in the tumor? The meningioma is pressing the bone. So bone got thinned here because of the pressure applied. So that is known as pressure. And last is idiopathic. So in atrophy, I told you physiological, pathological. 6 examples of physiological and 6 examples of pathological. So I have to stop here. Still metaplasia and dysplasia is remaining. That I will continue in tomorrow's lecture. And after that, I will start with reversible cell injury. Reversible cell injury, and in irreversible cell injury, I will teach you apoptosis and necrosis. So that's how first chapter is completed. So I will cover all important points from university point of view. Please let me announce my next lecture. Then you people can leave. So till now, I hope you got it. You got it till now. Okay. So just a second. Okay. So my next class will be tomorrow morning. Tomorrow morning on Sunday at 11 a.m. on YouTube only. It will be a free class. I will cover the remaining portion of the cell adaptation. That is till now we have covered 3. Hyperplasia, hypertrophy, and atrophy. Now I will cover metaplasia and dysplasia. Then I will come on cell injury, which is very, very important. Various mechanisms, the 5 mechanisms of cell injury, and reversible and irreversible cell injury में morphological changes. And in the third lecture on Monday, I will start with apoptosis and necrosis. So in the 3 days, I am going to cover the first chapter of the pathology. Very, very important. You can expect one 5-mark question from this chapter. Either the 5-mark question will be on adaptation, or it will be from injury, or it will be from apoptosis or necrosis. But one 5-mark question is you can expect. It is highly expected in your paper 1. So don't miss this opportunity to learn it. And in the end, I will provide you with the short and long question important for your university exams. So I will provide you a list. I will provide you a list in the next lecture. So thank you very much for being with me. I really enjoyed teaching you. If you like the lecture, don't forget to click on the like button after watching this. Please drop a comment, your suggestions, your feedback in the comment box. Whatever you feel, please write down freely without hesitation in the comment box. So I would like to come to know that what you are feeling, how you have learned it, and what modification you needed for further, right? Please don't forget to share with all your friends of MBBS. It is a big initiative taken by Unacademy for free, and you should share with your friends also. And don't forget to click on the subscribe button of this YouTube channel, that is Future Doctors. Thank you for being with me. Okay, see you. All the best. Bye bye. See you all tomorrow morning, 11 a.m. in the morning. Okay, I'm ending this lecture.